Honored to be introducing Rob Fraser to you all. So Rob is a practicing RN who works at Toronto General Hospital and also at the patient order sets development. He's also a published author and a dedicated volunteer, and we're really happy to have you join us today. And it would be great if you could tell us a little bit about your nursing career thus far, particularly like what you've been doing since you graduated with your master's.
Okay. Thanks for having me. Really appreciate you guys coming out on your lunch. I know some people have conflicted with classes, so it's actually kind of nice because hopefully we can have more of a conversation and talk directly about whatever you guys want. My career, or my tagline for my career is really loved by many, paid by a few. And if you look at my resume or things that I've been involved in, it's essentially been following my passions and what I'm interested in. And from global health and community development, working in a few different countries like India, Cambodia, Germany, and Trinidad and Tobago, to acute care. I work in Toronto General, actually just in general internal medicine, and I still have a career there. I do a bit of consulting and strategic work with pharmaceuticals, hospitals, around online engagement with patients. And really, for me, it's about figuring out what your kind of values are and trying to pursue opportunities that are interesting to you. I think especially within nursing, when you go into your undergraduate, it's very easy to just kind of follow the path of getting a clinical job and then just seeing where it kind of goes from there. And the more you understand what you're actually passionate about doing, the activities, it's easier to be a bit happier no matter where you end up. For my peers who were taking their undergraduate and didn't get the job in maybe the sick kids ICU, or maybe it was the cardiac ICU at St. Mike's, or some kind of job title and job area, they were the ones that ended up being dissatisfied with what they had studied and the output of all that kind of hard work. The people that knew that they were passionate about working with people and actually making a difference in people's lives ended up finding out ways to get to where they wanted to go, even though doors were shut early on. So they ended up working in long-term care, making a pivot into an internal medicine unit, and then got to their kind of position in, I don't know, the NICU at Sick Kids, or whatever original opportunity they weren't able to get to. So one of the things that I'd really encourage you guys to do as you're thinking is not to think about job titles and job positions, especially in an age where there's less and less kind of postings or understanding of what job opportunities are going to be around in 5, 10, 15 years. If you guys take some time to actually think about what you're passionate about and what you like doing, it's much easier to be happy in the roles that you're currently in and make changes and make pivots and explore opportunities, rather than saying, oh, I'm not, director of nursing at this hospital, so you're dissatisfied. Because when you get there, it's going to be similar to any job that you're currently in. There's going to be challenges. There's going to be parts that are very difficult. There's going to be parts you don't like. But if you can't identify what you're doing in your current job that you actually love, it can become very hard to actually stay passionate and engaged in order to make those career advancements and to create those next opportunities for you guys to advance. And pretty much everything that I'm currently doing, I didn't really plan, and I can't honestly say that I know where I'm looking to go next or what I'm trying to do. It was mainly actually just being involved and interested. So for me, I can actually point back to my undergraduate. I was in a motorcycle accident. So I couldn't actually go into nursing practice right away when I graduated. So instead of just kind of waiting until the rehab, the surgery, and all the legal stuff finished, I just looked for the opportunity to do something and ended up doing my master's. And even before that, while you're students, I think this is one of the best times to really explore what you're interested in. Because taking a job in policy and practice and then finding out that you actually really don't like that kind of tedium or that type of research isn't maybe the best strategy, because you're already looking for a job change. If you get your project experience, or maybe you just do some volunteer work where you get that exposure, you can figure out what you actually like about that versus just saying, oh, I really want to work in this area, and then waiting until the job exposure teaches you what you actually like to do. And especially when you're students, I find there's a very odd phenomenon where you're almost a neutral player. When you're a student, people will open up a little bit of time to talk to you. They'll open up the opportunity to speak with them, especially at different organizations. Once you're actually an RN at different organizations, people start to think about you a little bit differently. And I don't think it's a negative or a conscious kind of choice. I think it's more just an inadvertent kind of thought that you're working for a different organization, so they're a little bit less open to you, or they maybe don't divulge. When you're a student, there's something about teaching in a lot of nursing leaders and nursing managers that they want to kind of shape you and give you information where they can actually kind of hopefully recruit you or bring you on to work with them or to their organization. So really, don't wait until you graduate to seek those opportunities. Really go out and start connecting beforehand. The more you can get that type of exposure and start to build those relationships, the more you actually can hopefully figure out what you're really passionate about, and also be notified when opportunities are kind of created and people will think about you versus just saying, okay, I have to post this on a job board. It's much nicer to receive an email saying, hey, we're looking for someone to fill this type of role. Are you interested? Than to spend months and months hoping to see something on monster.com that piques your interest that could be your next opportunity. And the other thing that I'd say was really helpful for me was continuing to learn outside of classroom. There are so many resources and ways that you can learn from getting involved in different organizations. I'm currently the chair of Emerging Health Leaders, which is a group of people that are no longer in their formal education but are in early stages of their careers, who put on local events and opportunities for people to continue to connect and to reach across organizations and learn from each other and actually meet senior leaders and get lessons from them. Because again, once you're in that organization, there's not necessarily time in your week created for you to facilitate that. And I've met very, very interesting people and got exposure to what's going on outside of nursing. I think so often we go to the RNAO events, we go to the ONA events, and we kind of get into this sphere that we kind of end up hearing the same ideas. So it's really nice, and a great way to learn is actually going to something that's a little bit outside, maybe within healthcare, but maybe it's just entrepreneurial or business or other kind of areas that you can learn and be exposed to things that you can actually bring back to your actual nursing work and to our profession. I think that's it can be a challenge sometimes, and often people leave the nursing profession when they don't get opportunities versus going outside, learning something, and then bringing it back to the profession and incorporating it into your actual nursing work, nursing roles, and into the education and the mentorship of others. And you don't necessarily have to go out and pay for some of these things. I'd highly recommend checking out podcasts and online learning opportunities. I'm currently a student of Johns Hopkins University through Coursera, and it cost me $49 for each of the modules that I'm taking. And the quality of education I'm getting from that is definitely surpassing some of the things that I got out of school, because I was busy, I was rushed, it was in a textbook, and the assignments weren't as good. It's very interesting to see what's becoming available online. And one podcast that I highly recommend to anyone interested in administration or developing their career, it's called Manager Tools, manager-tools.com. And that one website I've got more value out of than any course or like university degree, and it's free. Every week they're just giving you constant career guidance and support about how to do management, how to manage your own career, how to communicate with colleagues, how to accomplish things. And it's very practical advice. And for me, their career kind of ethos is that it's all about relationships and outcomes. And just even hearing that and kind of starting to think about that, what are you doing in your actual kind of graduate work that you can kind of point to as an outcome? And what are the things that you're doing that are building your relationships? Because I think that's really what will help you to develop an interesting career and get you into the door and into those opportunities to actually make practice change, to do the things that that you come into grad school being wide-eyed, passionate about, and wanting the opportunity to do. But just finishing coursework doesn't always give you that opportunity. The more relationships that you have in the areas you want to work, and the more you can really point to, I had this opportunity, maybe it's working with the graduate student nursing unit, and in my term, I organized 16 events, there were 55 participants, and I performed. Because that's what really gets your resume out of that pile of others, because they know that, yes, you've got an education, yes, you've had multiple jobs, but you also can achieve outcomes. I think that, for me, has been something that was really helpful, because I've actually gone through my nursing roles and started to think about what are the things that I'm actually doing that I can point to as an outcome, something that I'm achieving because I'm in this role, not just the minimum job requirements, because even the people that fired from their jobs can put on the resume what their requirements of the job were, but the people who excel and perform well can point to the outcomes that they achieved because they were in that role. And I think those are the kind of high-level lessons that I wanted to share, and I could talk about consulting. I can talk about working in an informatics company. I work at patient order sets where we translate knowledge into medical checklists and clinical tools. And it definitely wasn't a job that was on my kind of career radar. It was through a network and being present online that I was contacted by a recruiter to work in this company. And it's been fascinating to come outside of the healthcare a typical approach to research. I've worked in UHN doing research. I've worked with a few other innovation groups and policy shops, and it's fun to work in a different environment. So I'm happy to talk about any of these types of things and turn it more into a bit of a kind of conversation about it and really focus on what you guys are interested in. Because I think that's, the major kind of lessons that I wanted to share. Any thoughts or questions? And if not, I can just start asking what you guys are interested in. Absolutely. In the land of the blind, the one-eyed man is king. It's one of their favorite sayings on that Career Tools or Manager Tools website, and they'll give you a template, and I follow it to a T now. It makes it very easy, and again, it stands out because every resume will often look at just responsibilities, but nothing really stands out. People make them really long, 4 or 5 pages to try to say that they're doing a lot, and an effective resume is 1 page. And it has your most recent experience and the outcomes most related to the job that you're applying for. You don't need to say everything. And they have some specific advice, and I follow it now. I just have an ongoing kind of long document that every quarter, essentially, I go in and look at what I've done, and I add to it. So the committees that I've been involved in, the boards that I'm working with, the clients that I'm working with in my full-time job, I add on little things about what I've accomplished. Because when you're applying for a job, it's very hard to go back and be like, oh, what did I do in this role 5 or 6 years ago that applies to this role today? It's very easy to go into a long log and be like, okay, so for my 1-page resume for this job, I'm going to grab this because maybe there's committee work. So I'm going to take the coordinating role that I had here, plop that in there, and the objectives, these are the 3 best objectives for that job. This one, describe it, and you still put the responsibilities, but it's just 1 or 2 sentences, and then your outcomes, because that's really what will create that shine of how you actually you've got the job, yes, and you had responsibilities, but you also achieved some significant outcomes or something you can point to. And I think for me it was very interesting to look at in my nursing career, because when I was in internal medicine, it's hard to look at outcomes. But starting to actually count how many patients I'd cared for on shifts was actually just interesting for me. How many medications I could administer, I still haven't been able to quantify that, but I'm like, oh, I wish over the last 3 or 4 years I'd somehow be able to keep track of that. Because again, it's so interesting how much work we do, but how little credit sometimes we actually take for the outcomes we're actually achieving. And not filling out a medication error report in 3 years at the organization. That's something I put on there because that's something I'm really kind of proud of and something that I could actually show as an accomplishment. Showing up to shifts on time, things like that are usually part of the job description, but any type of thing that you can start to say, what makes me different and shows that I'm actually achieving or being the ideal kind of person in that employment opportunity. And especially while you're a student, you can point to certificates you've achieved, other kind of points of education where you're invited to speak different places. And instead of having, again, the 6 pages, you can just have that as an accomplishment underneath one of the jobs that it's related to. Any other practical questions? Happy to talk about resumes ad nauseum. So the first question is, especially being a male, you get all sorts of very interesting responses to saying that you're a nurse. And I found early on you have to be very proud and confident in that kind of role, because from it's a role for females to thinking you wear white caps and not actually knowing. And I find that you really have to start thinking about people not knowing what you do as an opportunity, as something that you can actually explain to them why you like that type of role or what you've learned in it. And it's mainly about marketing yourselves. And I know I was just watching Sheryl Sandberg's talk about leaning in and just about how, especially females need to talk confidently, because males, when they finish tests, are asked about their IQ, always are wrong, but on the overestimation side. And females predominantly will underestimate their actual intelligence and competence at things. So I think it's really important for nurses to start talking confidently about what they're doing and the skills, and especially in business. If you can take care of a family or a person who's dying or very upset and throwing things, we work in very difficult situations, and that is totally relatable to communication skills, working with the public. So we have a great skill set, managing multiple priorities, yeah, I think we can do that really well. So I think it's seeing it as that opportunity, and especially if you respond to it versus saying they don't know, shoot, they're not going to understand it. If you really kind of, again, find it a fun game and just relate it into terms that they understand, then it opens up all sorts of doors, because the pressures that are put on nurses, the judgments that you have to make, they're very relatable and can be translated. And especially if you can point to outcomes, it's very easy to actually, again, articulate your value confidently to other people and show that you can learn, because a lot of people have transitioned between different types of units. Like, you can prove that you could work with, I don't know, from geriatrics to emergency or from cardiac to neuro. That is you demonstrating that you can learn and develop and change into that role. And so it's just articulating it and learning how to do that in marketing that I think is really important for nurses and clinicians to always do, and to make sure we're actually part of business making decisions, and to explore where we could work outside of the traditional nurse, manager, educator type of like job opportunity. There's so many opportunities out there. Nurses are very skilled, more and more educated. Kind of makes me a little bit afraid for who's going to be taking care of patients, because we do have so many opportunities. And I think hopefully there'll be more opportunities where we can actually also have an impact on organizational decision making and clinical care in the future. Sure, happy to give a sales pitch. So patient order sets, it was started by a physician at Trillium Healthcare, working in collaboration with nurses. You're all probably very familiar if you've ever worked with paper orders. Is anyone paper-based? Yeah. So physician writing can be hard to understand. They might come back and actually say, oh, I forgot to order this lab when you're drawing that. So they started to make clinical checklists, and it was for disease-based, which they were frequently seeing in the ICU. So that's where it got its origin. It's really making medical checklists. And the company kind of started to be open source, but then they needed to develop an IT component, because everything that they were doing was paper-based, and they knew if they really wanted to grow and reach other hospitals, they had to create an IT solution. So the company's transformed into essentially merging clinical ideas and needs with IT solutions. So the order sets is still the largest part of our business, making actual clinical checklists for things like sickle cell, diverticulitis, sepsis. But we're also now developing tools like MedRec for patient monitoring at home, so you can actually see, are they doing exercises? Do they actually have an increasing pain score, more signs of infection, so that people can intervene? So really it's getting clinicians to work with IT at this point now. And my role is within the research and development part, but I took the opportunity because it was a relatively new, it's 8 years old, and growing company, because instead of just being in my kind of siloed opportunity where you do clinical research and create a policy, it's an open office where we actually get exposure to the chief technology officer, to the IT teams. So it's not just computer programmers or IT people developing tools based on what they can. There's a real kind of conversation about what clinicians need and what IT can do. So for me, it's a fun company, and my role is working within knowledge translation. So taking guidelines that are coming out and turning it into medical orders that can be easily followed and tracked. And we also have nursing order sets, which is helpful for documentation and making sure initiated follow-up is started based on nursing assessment. So yeah, my kind of day-to-day job is a lot of research. And the neat part essentially is when we publish, we have a network of hospitals, and we share our guideline with all of them, but they are also sharing what they're doing with it. So we're actually also learning from our healthcare partners and creating a network of learning. So when a large hospital that is a center for cardiology publishes something, we can kind of pay attention to that, listen to that, and develop it. Or if 3 organizations publish an order set on PICC line insertion, then we can develop a model, do more research on it, and then publish that out to the entire network. So for me, there's a social and sharing aspect that I like a little bit better than some of the checklist companies that are just publishing, because they're publishers. They have the knowledge, they can just push it out and sell the information, but the clinicians actually don't really have much input. And those ones mainly come from the States, and we've learned it's a little bit different because they're competitive. They don't necessarily want to share. Whereas in Canada, there's a bit more openness to it. Hospitals want to be recognized as centers of excellence, so there's a bit of ego, and there's not true market competition with each other, so they're willing to actually let other people have access to seeing that. It depends what the hospital is doing. So essentially, the order sets, it's almost like having an additional professional practice staff. If we look at the number that a individual can make or even a medical advisory committee can make, their overall productivity and output of order sets is fairly low, because getting the research done with the pressures and the small staffing they have takes a lot of time, whereas we have this library of, I can't even remember how many hundreds of order sets that we have. So they can just take that, bring it to their MAC, and it's already pre-built, and then their medical advisory committee or nursing advisory committee says, okay, well, our formulary has this drug, so switch that out. We're actually in the community, so we can't do that or that, and we're going to do a transfer at this point instead. So
I didn't know that.
Yeah,
because
so
we have them for every imaginable surgery. We have an order set and a clinical lab where I worked.
Yeah.
And then I worked in Emerge too, so we had a sickle cell one and renal colic one. So those are likely coming from a library somewhere.
Yeah, potentially. If not, then they're also often developed in-house. And the other challenge with the in-house is some of them get developed once and then they don't get regularly updated, whereas we push out an update on order sets every 2 years. We have a small but growing library in mental health, so we definitely have some admissions transfers. They get a little bit unruly because it's not as systematized for some of it, and especially the medical checklist. If you listed all of the possible medications for schizophrenia, it would just be a long list, whereas a lot of the management is a bit more specified to where they're at, what's working, not working. So we have a few in mental health, but it's definitely something that we're slowly growing over time, and it changes essentially when we get new clients in hospitals. It changes what comes into our library and what priorities are for research. Where do you work?
I work at CAMH. Yeah, so there's a lot of protocols that we use in the Emerge, like CWAP protocol.
Yeah, and I'd say we have more of some of those CWAP protocols and things that are required for dealing with mental health in acute care versus as many that are specific for mental health care facilities. But again, it's starting to grow as more mental health clients come on. And it's very interesting because our solution essentially, we're not selling $1 million of IT hardware. We actually provide a fairly low-cost electronic solution or just paper-based access. So we're finding there's a lot of uptake in community hospitals and rural areas because they can't afford professional practice staff to do this development. And long-term care, primary care practice, because again, they don't want to spend a lot of money to buy something like Cerner, which actually doesn't come with any clinical guidance to do their clinical order entry. So it's very interesting to see what's in our library because it represents where we've worked. And the funniest part is we get more resistance from downtown hospitals. Like we were in a lot of the Toronto Emerge departments, but because everyone's an expert there, they're usually the slowest to come on board. So it's very interesting to see where people want to develop themselves, but then their actual output and creation of them takes so long that often slowly they come back to us and ask us for that help because we are really more of an accelerator, but people want to be the smartest in the room. So it's very interesting.
Yeah, just getting back to some of these pre-printed order sets and as far as having this information, because it has changed the way that we do deliver care because it does standardize it. Do you find that Accreditation Canada looks to this when organizations implement any of this new research that's brought in?
Accreditation Canada, their standards are more, like at some of the higher level and bigger diseases, they want to make sure that there's becoming a standardized approach to it. They're not looking as much at like very specific ones, but things like the medication reconciliation process, like the time to admission, things like that. And order sets are often like a piece of solving that kind of actual problem. So I haven't heard of any news where they're looking for like it. Mm-hmm. So coming to us at accreditation time or asking the questions about research?
Well, mainly for the year, we can general that
we find, I don't work directly in sales. I have a bit of contact with them, so take what I say with definitely a grain of salt. But we see a bit more of a flux happening around budget time because that's what depends when they can actually spend. There's probably some association with budget years and accreditation for sure, but I haven't heard of people specifically reaching out, and I'm not in all those sales calls, so I'm not too sure about the accreditation piece, but the research for sure they ask about length of stay. And we more have research on the broad piece, like of order set implementation in general. Some of the exciting pieces are where we're now looking at pathways and starting to be able to pull out information from EHRs, looking at things like length of stay and associated lab values. So I really do hope that in the next few years we can actually attach order sets to clinical outcomes and length of stay so that for specific ones we can start to look at what's happening and also look at not just what organizations are publishing, because we often think that people are experts, and if we see a new order set or a new order line on an order set that we're working on, we have to go and do research to justify it. Whereas if we can actually associate their order with what their outcomes are, we can understand very quickly if what they're doing is actually helping or maybe hurting their actual outcomes. And instead of just waiting for guidelines, we might be able to actually push data to guideline developers because often guidelines are so like stats. It's the law of averages. They take the typical case. Does anyone in here know about the QBP guidance that's coming up from the Ministry of Health? So the quality-based procedures are a big shift for the ministry that's going to affect funding. And it's essentially trying to identify how much should a typical COPD, heart failure, and all these different procedures generally cost, and pushing people towards lowering that actual cost through following a standard set of protocols. But they come out for COPD, and it takes the most general COPD, but it doesn't talk about COPD with heart failure, COPD with diabetes. It takes the average because that's what all the research is about. So for us getting more of that data and being able to attach it, we can actually start to help people like the ministry say, okay, for COPD, heart failure, and diabetes, these are some of the other things that you should be getting hospitals to make sure that that's thought about. So it's just not, okay, you have COPD, we'll give you all your COPD meds, and then 2 weeks later you get readmitted, but we say, oh, no, you had an exacerbation of COPD, but we're readmitting you for heart failure because we didn't treat that while you're in hospital. So hopefully we can get away from just guidelines around the averages and help to expose that data that actually allows us to treat patients as unique and complex as we're actually seeing in healthcare. So for me, that's a interesting part that we'll hopefully get more and more data about specifics versus just making a broad catch-all approach. I started before I actually went into nursing doing some community development work, working in children's homes in Trinidad and Tobago. In India, I was doing more palliative care work, and it was supportive work because I was only partway through my nursing education. And then Cambodia, I was actually doing more health provider education to workers that were doing sexual health education and helping actually support them do business planning and a website development because they actually wanted to get more donations and funders. So there's that. And then I do consulting for a global initiative called Connecting Nurses, and that's a partnership between ICN and a few different nursing organizations, looking at how to essentially get more nurses connecting online and in real person. And that's related to my work on social media. I wrote a book on that in 2011. I know a lot of people who have actually just got involved in some of the RNAO interest groups in international nursing. That's how they got connected to certain international work. So there's definitely organizations if you are interested. Mine was just through people that I happen to know that were doing the work. And then I was interested, so I asked if I could actually participate and go. Trying to figure out and narrow on a few ideas within global health, because it's a very large kind of bubble, will help you figure out who to get in touch with on the different areas, whether it's epidemiology or if it's in technology. There's lots of interesting things going on there. So the more you might dive down into what people are doing in those areas, you might find opportunities to do it with or without traveling. Any other questions or things I can do? If anyone is interested in working at patient order sets, let me know. Or we definitely are open to having grad students come and do their placements and things like that. I know I was speaking with one student about that, and I think for me it's fun, and I'm hoping that more nurses will try to get experience outside of the traditional organizational roles, and whether it's with us or other companies, I'm more than happy to talk about what opportunities there might be. I know consulting was not something I ever learned about in grad school, and it's definitely been something that is kind of a learning experience because when the opportunity presents itself, I took it up. So more than happy to also follow up and take questions if you guys do want to talk about that or have questions that you think about later. Sure. In 2011, I published a book. It's called The Nurse's Social Media Advantage. It's published with Sigma Theta Tau, and it won an award from the American Journal of Nurses Association. the American Journal of Nurses Book of the Year award. And throughout my undergraduate, I was just interested in using technology to enhance what we're doing within healthcare. So I started to build websites. And I tried to get some professors to help, but everyone was like, oh, that's a good idea, but I'm a little bit busy. I have this course that I'm teaching. I'm doing this research project. And they kind of pat me on my head and say, that's a great idea. You go do that. So eventually I was like, okay, I'd love to do that. I want to make a website on like patho because I was just struggling with that class. And I was like, but I don't know anything about patho. So what I started to do was actually just do interviews with nursing leaders and researchers and people that I was meeting that I found interesting because they were passionate about their work, but they were just putting into journals. And journals aren't interesting. When you talk to someone about what they're doing the research on, they are interesting. They've dedicated their time, their energy. They see beyond what they publish, and they can talk about it. So I wanted to share that. So I just started to do this website as a second-year student. And that, to me, was really interesting because it would get watched in Europe and Australia and America when people were just searching for it. And I saw that it's interesting to me. So I just kept on exploring these digital tools because they were cheap or free, and I could share what I was passionate about, and I could actually do it I didn't need a job, I didn't need someone else to create a new position, so I just started to do that, and from that experience I started to then present on it and try to share it and convince more nursing leaders, because they'd be like, ooh, what's the research on social media, and what's the, I'm like, there's no RCTs about this. This is the way that communication's going, it's what businesses are doing, come on, let's do this. So I just try to get more writing and presenting out there, and from doing that, I was then asked to actually write the book. So the book is really just about how nurses can use it in their careers. It's not just something that you're going to get fired for. It's not something that it's just a bad thing and you need to stay away and can't have a profile on. It's more that there's risks and opportunities. It's a tool. A hammer or a nail gun is very useful, but it's also dangerous. So social media, I really just wanted to create a dialogue about what practical uses there might be and how to mitigate the risks so that you can use them to actually achieve that benefit. So that's what I wrote the book about, and I might be writing another one following up and thinking more about the organizational level and how these tools can be used, not just for marketing. I don't think it's great if you open a new hospital wing, it's great if you have a new robotic surgery, but patients want to know about what they're going to do with their wound when they go home. They want to know how to deal with their COPD when there's an exacerbation, or who to talk to, or what to do about their diet if they're suffering with heart disease. So I think organizations could actually use it to achieve strategy, to actually improve patient outcomes, for education, for learning, for recruitment, for actual clinically strategic objectives. So I'm working on a proposal to write more about that. So that's what my book was about. And I definitely graduated thinking that I was so glad from my undergraduate that I just don't want to write. And then I got this opportunity. So really, when people come to you with an opportunity, try to say yes. If there's an offer, and if there's no offer, figure out a way to just start somewhere and to actually turn an idea into reality. I think too often we wait for that job where our role is to videotape and publish people on the internet. Figure out what you can do to actually start to make change, and that's something that you can show that will get you a job, or that you can prove to an organization, say, hey, I've done this, create a job for me to do this because it'll have this benefit. So don't just wait for a job posting as an opportunity to start something. Any other last questions? If not, thank you guys for taking your lunch. I really appreciate the chance to come talk with you guys. I have a card. If not, you can Google Rob Fraser and nurse. You'll probably find me. And I'm more than happy to talk with you guys and connect with you and pass you on to other people that I might know that could probably better answer your questions. Thank you.